Welcome to Urbanism Vancouver, a podcast that explores how our built environment shapes our everyday lives and community experiences. I'm your host, Helen Lui. Join me as we discover where we live, work, and play, and how we can shape better communities. With each episode, we'll bring a bit of insight and industry experience from myself and my guests. We'll dive into the inner workings of our urban surroundings and explore how places are planned, designed, and built, and discuss ways to create more livable, equitable, and sustainable cities. I hope that you'll learn a little and be inspired to be more curious and more involved in impacting positive change. Before we get started today, we want to acknowledge that this podcast is recorded and produced on the traditional and unceded territories of the Coast Salish peoples, including the Musqueam, Squamish, and the Tsleil-Waututh nations. We pay our respects to their elders past, present, and emerging, and recognize the enduring connection they have to this land. We strive to have our conversations contribute towards reconciliation and work towards sustainability and equity for all the custodians of the lands. Density is a hotly debated topic in urban centers. Is it good? Is it bad? Does it make us feel more isolated, more lonely? Or can it improve our happiness? Today, we take a deep dive into this topic with Houssam Elokda from Happy Cities and learn more about what research says about the relationship between density and our well-being.
Okay, well, Happy Cities, the story started like 15 years ago when our founder, Charles Montgomery, was interviewing the mayor of Bogota, the capital of Colombia, Enrique Peñalosa. And Enrique Peñalosa took Charles on one of the cycle highways that they built through many communities in Bogota. And his philosophy was like, we are not going to be as rich as the Americans, but maybe we can be happier. So the central focus of his efforts in transforming Bogota was putting cycle highways through the poorest areas, putting community centers and libraries, taking lanes off of their main highways and putting bus lanes in the middle. The Transmillennial program is like one of those bus rapid transit things that he did it before it was cool everywhere, right? So Charles was really enamored with what he saw there and this concept of the link between urban design, city planning, and happiness, that he decided to spend the next 10 years of his life writing a book about it. And the book was really the birth of our company. When it came out in early 2012, it became one of the best-selling urban planning books, and people started coming up to him and asking him, well, can you help us do this? Then with his co-founder, Omar Dominguez, they were like, we think we have a business on our hands. I joined not too far after, and yeah, since then we've been helping city builders, so municipal governments, developers, anyone who has any influence over the city, understand how to design happier, healthier, and more inclusive places. We've been doing research on the link between these two and starting to identify solutions to change the system so that it produces happier, healthier, and more inclusive places by default.
Your team recently did a deep dive kind of into density. The title of your piece that I read was called, "Does Density Hurt Happiness? Our New Study Says No." A lot of people might say that living in denser places or in apartments where people are closer together is something that is less good for your well-being, that makes you less happy. So can you tell us a little bit more about why, like what are the key things you found with that to refute kind of that claim?
So for this particular study, there's been a lot of conversation about how new housing is going to impact people's well-being, how it's going to change neighborhood character, how it's going to ruin people's neighborhoods, quote unquote. And we realized that particularly in Vancouver, that topic wasn't investigated as much as needs to be. is that actually true? Are people less happy in apartment buildings than they are in single family homes? But also, what about townhouses? What about, walk-ups? Like all these different elements. And also asking these questions like, is there a difference between a building that has a lot of social amenities and ones that don't? So we felt that was an important question to ask. Vancouver Coastal Health, they were very excited about the idea. So we started doing the study. It's called My Wellbeing, My Community, or My Community, My Wellbeing. I keep mixing them up. But what we did is that we surveyed over 2,000 people in Metro Van. And for most of the communities that we were looking at, we managed to get a representative sample. So we were very excited about like the number of responses we got. And we found that there is no evidence that density corresponds with lower health or less happiness, worse social connections. That what explained the differences, specifically after you control for income, were the quality of the neighborhood, the quality of the amenities that people can get to. Neighborhood walkability and having access to services, to transit, to parks was far more important to people's well-being than whether they lived in an apartment building or in a single-family home. And we found things like lower commute times are positively linked to mental health, happiness, and social well-being.
That makes sense,
right?
Yeah.
You're more likely to have lower commute times in highly dense areas than if you live in a very low density area. We found things that, that the top aspects that influence people's decisions to live in their neighborhoods are proximity to transit, affordability, nearby shops and restaurants, outdoor spaces. And when we asked them, like, what are the top aspects that you feel is missing from your neighborhood? People said it's, again, affordability, proximity to family and friends, and that they were missing a sense of community. We've also found something interesting, that people who have more stable tenure, so who manage to live longer in their communities, that they are more likely to have stronger social connections overall, not just within their community. And one interesting question that we always ask is about trust. We think trust is really important. And we ask that question by actually like telling people, if you lost your wallet on the street in front of your house, how likely do you think that you'd get it back? That's like it's a well accepted a way to measure trust. And we found that people who report a higher sense of trust and belonging to their neighborhood were more likely to report higher social connections, better health, and to report higher happiness. And we were trying to think, okay, well, what actually makes people feel a greater sense of trust in their neighborhoods? And the top correlator was access to a greater amount of park space. So they have more parks nearby, that is correlated with higher trust in your neighbors.
So is there something that you were able to, like, what is happening at the parks that is elevating people's trust levels?
I mean, we spend a bit of time trying to like figure out how do social relationships happen, right?
Right.
And it boils down to basically what I like to call repeated interactions with a limited number of people. This is why smaller towns rank higher on happiness generally than bigger cities.
Know everyone.
It's because like live there for a couple of years and you will have met everyone, because the scale of the number of people you meet is so limited. They get the limited part of the equation, right? And the repetition happens just with time. Like you don't even need to live in the same house. You'll meet the same people over and over again. But in big cities, the scale of the number of people that surround you is much. You're just constantly bumping into people that you've never met before.
Right.
And if you think about, what is the likelihood that you'll bump into this person again, you realize that actually, no, the way the neighborhood is designed has a huge impact on that. Because if you have a coffee shop nearby, and you go to it regularly, you're very likely to see the same person over again. And what happens is the first time you see them, you'll probably not even like, at most you'll share eye contact, but you probably won't even like acknowledge. See them like 3 or 4 times and you might like nod. That might turn into a hello. And that it all depends on each individual's level of friendliness. Even, the most socially awkward people with repetition will build some level of relationship. The research shows that just even, obviously your relationships with family and friends have a huge impact on your well-being. But there's also something called the weak ties. Your superficial relationships in your community, like, knowing the barista in your coffee shop by name, like these are, you don't call them in need, but you go into a place and they recognize you and you recognize them. That has an impact on people's well-being. So what you find is that neighborhoods that have more opportunities for people to casually bump into each other without pressure tend to have stronger social relationships.
So you brought up the example of the coffee shop. But before also you said that the park is the one that people like consistently say is the thing that, high level of trust. Is there other places that allow for the creation of those weak ties? And is park rated highest because that's the place in our society that has like least pressure? Or like, I'm just trying to figure out like, why is it park and not like just a general plethora of like park and like coffee shop? Or do you know what I mean?
Well, I can't say that the research dived that deep to like say like why park and not anything else, but I can speculate. There are not as many places where you can just be outdoors in your community and not feel like an imposter as inviting as a park. Parks tend to have some level of programming, so it gives you a reason to go, whether that's a food truck that's there or kids playground, or some kind of event or thing that's happening. Also, parks, independent of their social potential, have a lot of greenery and access. Just looking at nature improves your health and well-being. It improves it on many accounts. Like there's studies that show that like hospital patients who have views of nature recover much faster than ones who have like views of a brick building. That people who have more greenery within their site are just like more productive and can concentrate more on things. There's just like a plethora of correlations that like just the access to nature part of parks is powerful. Double it up with the social potential, and you get like a machine for well-being in your cities. That's the power of parks.
So we talked a little bit about trust, and that's like kind of tied to this ranking of parks. What else in that study did you guys find would relate to people reporting more happiness, regardless of whether they lived in a denser or less dense kind of environment?
Yeah, so we wanted to really dive deeper into getting people to describe their housing situation. So, for example, I mentioned density, as in like number of people per acre, is not correlated to well-being. But we also wanted to ask about like just the specific housing forms. Like you can have, a dense neighborhood, but it can have an apartment building and a single family within the same neighborhood. Is there a difference between, those who live in the apartment and those who live in the single family home? And what we found is that no, it does not explain the differences in well-being. Like denser housing forms, so whether you live in a duplex, townhouse, laneway house, apartment building, regardless of height, so low-rise and high-rise, that people who live in these housing forms were no worse in terms of their well-being than those who lived in a single detached home. And whatever differences we found were explained more by people's income. So when you control for income, most of the differences between housing forms go away. What we did find was one type of housing form that, even after controlling for income, scores lower on many metrics, which is basement suites.
Oh.
Which was really interesting because it's not particularly surprising, but it stood out. Obviously, people who have higher housing costs are worse off than those who have lower housing costs. Renters tended to report lower well-being than people who owned homes for, you can surmise obvious reasons in our current climate. But the one kind of other thing about housing form that we looked at is unit sizes. And that was actually, in a sense, is one of the earlier questions that we were asked to answer, is like, is there a correlation between unit sizes? Because with the extra pressure on density, there is an incentive for people to to provide really small. And while that can, add more units in a potential building, people were concerned. Well, what's the threshold, right, where it becomes difficult? And we found that threshold where it starts affecting your well-being is under 300 square feet.
Which is really small.
It's
really small.
I mean, it works for a very specific type of people, but we find that it was linked with lower happiness, lower physical and mental health, even after we controlled for income and other factors. And worryingly, people who lived in these super small units were more likely to report lower household income and more likely to report a disability, which is quite concerning because tiny, tight spaces and having a disability don't gel well together. It doesn't necessarily, we're trying to think of what's the takeaway? Okay, ban apartment units under 300 square feet. But that doesn't address the problem of why people would feel the need to live in a housing form. It's just like a repercussion of how ridiculous our housing crisis has gotten. The people who suffer from our systemic failures tend to be the people who are most vulnerable. Unfortunately, they have probably been suffering for longer than how long the general population has been suffering. We've only started to acknowledge these as problems as to when, the average person started to experience it. Kind of tells you why didn't we start to acknowledge these challenges early enough? And now when we're in so far into the housing crisis, and the outcomes of it are really, really terrible, it's not something that happened overnight. And that's the sad reality of it.
Clearly, your research is showing that density is not a factor in why people might report higher or lower well-being, and yet our society has such an adverse reaction to density. I mean, you're constantly hearing things about people saying, oh, it's not natural for us to live above the fifth floor, or people are packed in like sardines, and they might be talking about units that aren't even, 300 square feet or smaller. It might be like a 500 or 700. So I don't know if your study got into this or any of your studies did, but can you speculate as to why we have such a strong reaction to density, and that there's this preconceived idea that it's associated with people's lack of well-being for people or lack of happiness?
I think it's probably related to how maybe humanity's first foray into very dense housing was riddled with mistakes. A lot of the early aversion to apartment buildings were, situations where these buildings were not safe, where there was overcrowding, where they were prone to fires, and we've built ourselves into this stigma. Even after that, further, just examples of density that was done very poorly. Put on top of that is that initially people who were more likely to live in apartment buildings were people of color, were immigrants, were people of lower income. And then you kind of set yourself up for a collection of bias to associate higher density living with lower outcomes or lower quality of life. But outside of this mostly North American phenomenon, the vast majority of people today are living in denser settings. The concept that the norm for every person is a single family home with a front yard and a backyard is unheard of in many other countries. I grew up in Cairo, I grew up in Egypt. I lived in an apartment building for my entire childhood, and so did pretty much everyone I knew, and we loved it. It had so many great elements of it. I've only started seeing people in Egypt live with front yards and backyards when they started importing North American kind of designs, and designers coming from North America to design gated communities in the middle of the desert with golf courses, which I can rant on in another podcast for you, Helen.
We can schedule that for a future one. But I mean, first of all, agree with all of the things you said about why that bias is there. But then on the flip side, a lot of people do associate this idea of density in an apartment of this is for now. This is for when you're 20, when you're it's not for a family. It's not for, like aging in place. It's like, it's for now. And then the ideal is the place where you have more space, where it's not density. So that is a whole, like there's a whole, psyche behind that.
The thing about that is we're not or at least we shouldn't be as urbanists in the business of telling people what their preferences should be.
Right.
And what really the issue is when these preferences are prioritized over the well-being of the majority of people, right? It's like, okay, you want to live in a single family home. Great. It costs a lot more to service a single family home. It costs a lot more to provide services, to provide transit, to provide all of that. Are people willing to pay for these costs? The answer is often no. And what you get is low density matched with a very high amount and quality of services that are not being spread out equally. That, obviously it's great to live in a single family home, have bus that comes every 5 minutes or a SkyTrain station within 5 minutes of my house, the best coffee shops, the best schools, the best all of this. Can you realistically provide this for everyone who wants it? No. So then the other option becomes you provide it for a smaller number of people. And that is exactly what inequality looks like. And unfortunately, it's become the reality of most North American cities, and why you see that lower income communities are the ones that get densified first, because they don't have the resources to organize against density. It's a question of values, a question of what we prioritize in our cities and what we accept as what is fair towards residents. All that being said, if someone wants to make the choice of living in a single family home and they think that's more important than being in proximity to all of these excellent services, that's their right to do that. If they can figure out, how to do that while paying their fair share,
right?
That's fine. Great.
Yeah, I think that's why, for good reason, we're seeing a lot of policy now to densify those neighborhoods where all of those services exist, but don't provide a fair share of the housing and therefore a fair share of people being able to access those services and those amenities and those communities that more people could live in. And so you mentioned that in the past, we kind of did density in a bunch of different ways that were poorly done, I guess, is one way to put it. So looking forward now, we have a lot of policy to encourage a lot more density. What are some of those design attributes, or what are some of those considerations that people can take that is more people focused to ensure more happiness and more social well-being in new developments?
So at the foundation of urban well-being, of creating happy communities, is walkability. Just being able to walk to most of your destinations that you need in a day, in a week. And that, it's one of those things that we describe as it is your foundation. If you live in a building and the foundation is cracked and the building's about to fall, you should not be spending all of your efforts fixing up your doors and your windows, although they are important, but we are already failing at that across the country. I think the latest research that was done showed that 73% of new communities in Canada are car dependent. This is the equivalent of, running a factory that is still churning out faulty products 73% of the time. So the first thing is we need to turn off the flow of poor design and create places where people are not trapped into having to use a car to access jobs, to access services, to live their life. That is one of the big injustices that are happening in our cities today. And it is tying municipalities and people into cycles of isolation and poverty that we are paying for today. We have been doing that for over 50 years. We are paying for it today. And without, rapid change to reverse that process, it's going to keep creating more problems.
First of all, how do you define something as that's a community that's car dependent? Is there a certain amount of things they need to be able to access to be considered a walkable community?
Yeah, I mean, the funny thing about walkability is it's probably the most important concept in urban planning. It is also the most researched concept in urban planning. How we define walkability is, I think the best explanation of it is called the 5Ds, and I'm going to hope to remember all the 5Ds, but it's density, sufficient density to support destinations. So destinations within walking distance. For the destinations to happen, you need the density. They're tied together.
Right. Yes.
A grocery store isn't going to open in a very low density neighborhood. There's just not enough customers. Distance to transit, because obviously wonderful as walking and cycling can be, they really only fill the short to medium distance trips. And for long distance, which often is the case, if your job is somewhere else or you're going somewhere else, your options are really car or transit. Without good transit, more people will choose the car, and they're gonna drive more in their community, they're gonna drive more in other people's communities, and they're gonna demand more space in their community to park the car and to drive it around. So transit is critical. One more element is the quality of the urban realm. So I don't remember which D is that. It's escaping me. Listeners can correct me, but it's basically, there is a coffee shop within 5 minutes of your house. What is the quality of that walk? Are you walking alongside a highway, or are you, walking on a wonderful street that's lined with trees and feels safe and etc.? You look at these elements and you actually think about how many of our neighborhoods today provide all of that, and that starts to give you a sense of the problem. So why are we failing at this so miserably? As a society, we have figured out how to build really complex things.
Oh, yeah.
But for some reason, we can't crack this nut. So why are we failing? That's actually something that we have been researching for the last few years. And if I could summarize what we think it is, it's because, first of all, every single municipality probably has a completely different definition of walkability. Whenever they approach walkability, they're like, let's redefine what walkability means. It's kind of the equivalent of every single province creating its own definition for hospital every time they try to create a hospital. So what happens is a huge amount of effort wasted into, defining what walkability means to them. But then when we are building airplanes, aside from Boeing, when we are building airplanes, every single component of that airplane is tied to who is responsible for making sure it performs well, both from the building perspective, but also from the maintenance perspective. When a failure happens, you can point exactly to who failed at that responsibility. Today, there is no clear understanding of who is responsible for which components of designing a walkable community. As an urban planner, there is actually no expectation of me of how I can design a walkable community. If I design a community that mountains of evidence show is going to harm people's health and well-being for decades to come, I will face no repercussions. They don't even require me to be a professional planner to design a community. That's why architects do it, landscape architects, engineers design communities and subdivisions. And with all due respect, every one of these professions are very good at what they do, but we as planners don't actually have any set of standards for ourselves. But even when you're talking about different jurisdictions here, for a community to work, to be actually well designed, walkable, complete in all the senses that you can imagine, the planner needs to do their job. The architect needs to do their job. Imagine you design a really great public realm and then an architect puts a big blank wall in front of it. It actually has an effect on the street. Does the architect know that that's part of their responsibility? No. The landscape architect needs to do their job. The engineer, the road engineer who's designing the streets need to do their job. Because you can say this is a walkable community and then have an engineer design a slip lane in the middle of your main street. That's it. That just compromised everything. So even though today there's a lot of engineers, very brilliant engineers who have figured out and created standards for walkability, we haven't yet defined how all of these responsibilities work together. So we're actually, we've been trying to do this, to put together this project for the last year of like bringing people from different professions and coming together to an understanding of what each of our responsibilities are and trying to put that into the policies and the standards of our professions.
Okay, so on that policy note a bit, I think walkability is something that always comes up as a term in those discussions when, I'm working on new developments. But you're right, like there's no accountability. There's no like, you must do this for walkability. You must prove whatever this. But on the flip side, there's lots of bylaws about how many parking stalls, where they need to go, how big they need to be, how many loading stalls and all of that.
Like the contradiction of wanting to create a walkable community that's connected with really high quality transit while mandating parking minimums.
Yes, exactly.
Contradictory goals.
Exactly. But the other issue I find is practically by the time that I, in the role of a developer, go onto a site and I'm proposing what I'm going to build, I have no control over what things are available next to me. And I have no control as to how pretty the walk is between my site and the next site. Yeah. So what is the policy shift and what is the policy changes that you envision that would prioritize walkability over our focus of like how many stalls or cars or whatnot?
So obviously the challenge of that is working at the scales, right? You, as you're saying, you as a developer who's building an individual building, the scope of your impact is limited, but so is the scope of your responsibility. We can at the very least identify what people are responsible for at every scale. So we've somewhat done a lot better in this of saying like, okay, a developer building a new building is supposed to have an active, inviting building edge along at least the streets where people are walking. This is already like filtered into a lot of land use bylaws and design guidelines. That's kind of one way. It's funny. I think for developers, we have done the most work in identifying what they're responsible for. And we've done the least amount of work in identifying what we as planners, professionals are responsible for as well. And I think these things, they have to happen at all of these different scales to work. There isn't like, one policy element that I can point to, but at the very least, we shouldn't hinder developers who are trying to design things well. And we should simplify the standards and create the incentives for them to actually design things to high quality, that they aren't just forced to do it, and they actually want to do it. So this is the level of nuance that is implied on our profession to figure out on how to make cities better.
Houssam has shown us that historically, density was not done well. This was due to a variety of factors, such as exclusionary land use practices that discriminated against certain populations, to resulting negative perceptions of density, as well as myths about the impact of density on people's well-being. However, the data shows us different outcomes. If we are focusing on the impact of housing forms on our well-being, then research shows that basement suites, actually, have a greater negative impact than all other forms of housing. Income is a higher indicator of happiness, and unfortunately, those who are most marginalized and with lowest incomes are most correlated with living in smaller, less suitable housing. Our current housing shortage in Vancouver is not only negatively impacting affordability, but also it's reducing our overall happiness. When we add this to the abundance of car-dependent communities, where people must rely on vehicles to drive to their everyday needs, then we have a recipe for expensive, low-density cities where residents are more isolated and less happy. The data clearly shows that density promotes happier and healthier cities. And the first step will require that we prioritize and incentivize density in how we plan and build our communities. You've been listening to Urbanism Vancouver, the podcast dedicated to bettering our built environment. Be sure to follow us on your listening platform of choice so you don't miss our future releases. I'm Helen Lui. Thanks for listening. This podcast series was independently funded and produced by myself and Aaron Johnson. Visit us at urbanismvancouver.com.